Right. Hello, everyone. Good afternoon. My name is Kristen Paulson. I am the CEO here at the Center for Improving Value in Healthcare, or CIVHC. I think everyone has joined. I haven't seen the participant number jump in a few moments here, so let's go ahead and get started. Thank you for joining us for the Bidders Conference for our data management vendor request for proposal. Let's go ahead to the next slide. Just some housekeeping things before we get started. All the lines are muted. Please use the chat box to ask any questions. We are recording this webinar and we'll be posting it at our Data Manager Request for Proposal page on our website, which is linked below. Next slide. And here's the agenda for the day, for the hour. We're going to do introductions of the team. Then I will give a brief overview of CIVHC, and then I'm going to be handing it off to Paul McCormick and Maggie Muller to give an overview of the request for proposals, and then we will have time for a question and answer session. We will be collecting the questions from this session and posting the questions and the answers to the RFP website in the coming days as well. So let's do some quick introductions of the team. As I mentioned, I'm Kristen Paulson. I'm the CEO here at CIVHC. Paul, would you like to introduce yourself?
Yeah, thanks, Kristen. I'm Paul McCormick. I'm Vice President of Data Operations at CIVHC. And Janice, would you like to?
Sure. I'm Janice Bergalt, Senior Consultant at Friedman Healthcare. Maggie?
Hello, everyone. I'm Maggie Mueller. I'm the Director of Data Operations at CIVHC. Emma?
Sure, thanks. Hi, Emma Rourke. I'm a project manager at FHC, and we're supporting CIVHC in this work. Stephanie, did you want to introduce yourself?
I'm Stephanie Spriggs, and I'm supporting everybody behind the scenes here at CIVHC, and that's why I am off camera.
All right, thank you, Steph. All right, a brief overview of CIVHC. Go to the next slide. So CIVHC is an independent 501c3. We are a standalone nonprofit organization with a mission to equip the partners and communities in Colorado and across the nation with the resources, services, and unbiased data needed to improve health and healthcare. We pride ourselves on being independent and objective. We are the designated administrator of the Colorado All-Payer Claims Database and have held that title for approximately 12 years. And we're focused on serving people across Colorado and across the nation in the advance of better health and healthcare. Next slide. We serve a variety of organizations and change agents across the healthcare spectrum, always keeping consumers at the center of our work. But we work with employers, other nonprofits, researchers, government, clinicians, hospitals, basically anyone who is involved in the system, and increasingly a number of community organizations that are helping to support with non-medical efforts. Next slide. So we do this informing and data provision in a number, or support provision in a number of ways. First, we have our public Colorado All-Payer Claims Database data. These are reports, interactive dashboards, and essentially opportunities for improvement and trend trackers that we post on our website. Many of them have data that can be downloaded from that power those dashboards. So this is a way for us to be able to provide low-cost data to anyone who would like to be able to use it and really have a public forum for looking at what's happening in Colorado across the state and being able to benchmark that to other states. Some of our public reports are mandates for the state of Colorado, so we do have statutory obligations to create a number of these dashboards and keep them up to date and accessible for everyone. We also do non-public data release. These are where we are working with folks in the state and around the country to license data from the Colorado APCD to support their work, to support their specific project and research needs. These can take the form of a data set, a custom report, or other kind of data release. And then finally, we provide community services, and these are a number of different ways for us to really make sure that people have the tools they need to be successful in improving healthcare. As I mentioned earlier, we administer the Colorado All-Payer Claims Database. We also have a program evaluation and research teams that do innovative research here at Civic and also support community groups by doing evaluations of the impact of their work on their communities. And we have a number of other partnership opportunities where we really support success at the local level and try to really drive engagement at the community level. Next slide. So what is currently in the APCD? We have over 1.1 billion claims in the APCD, covering, made up of 74% approximately of the covered lives in Colorado. We collect data monthly from 49 commercial payers, plus Medicaid and Medicare fee-for-service, as well as Medicare Advantage. There are over 5.6 million lives per year represented in the APCD, and we also present trend information going back to 2013 up through our most recent data. What's not in the Colorado APCD is similar to what is not in many APCDs. We don't have the federal programs, so we don't have Veterans Administration, TRICARE, the DoD programs, Indian Health Services, Federal Employees Health Benefits, etc. We do not have uninsured or self-pay claims, and we are missing a large chunk of the ERISA-covered self-insured employers in the state as a result of a Supreme Court holding back in 2016. Next slide. So I am going to hand this over to Paul and Maggie to give an overview of the RFP and cover what it is that we're looking for in this request for proposals. Yeah, Paul, Maggie?
Thanks, Kristen. Next slide, please. I'll give a little overview. So primarily what we're looking for is a data management vendor that we can work collaboratively with and efficiently with, and who has a demonstrated track record of these items. So data management innovation, what we're really talking about here is things like AI-driven data cleaning, real-time analytics platforms, and predictive data quality tools. So for example, machine learning in particular might be helpful for anomaly detection with data as it's being submitted. Driving towards streamlined and efficient structures and processes, we're talking about automation of manual tasks, centralized data storage, and reducing redundancies to make data access more efficient. We also want to minimize the handoffs that we have between teams and again, really automate those repetitive tasks. Readiness to take on new methods of data ingestion, enhancements, and linkages. This is especially important in this healthcare space where there are always new data sources, new methods of linkages, and new questions to answer. So linking claims and non-claims data, for example, can provide a more comprehensive view than claims data alone. Another example of this is bringing in social determinants of health data. Right now, we geocode the member addresses, and we're able to link that then to the American Community Survey data and make calculations like a social vulnerability index so that we better understand not only the individuals in our database, but the circumstances that they find themselves in and potential barriers to care. Lastly, innovative, contemporary, and scalable data architecture solutions. For example, cloud architecture that allows scalability as the data gets bigger. And the data will get bigger both in terms of more records and in terms of more columns of data. So we do expect it to grow kind of in both directions. This also would allow us to roll out new functionalities without impacting existing services. And this is a really important thing I want to call out. It's that if there are improvements that we're making to processing, if there's processing that's occurring, it's really important that that be separate from the production work that we're doing on the other side of that database. We really need those not to hinder each other. Next slide. So some core bidder requirements are to protect privacy while looking for the broadest possible use cases. So some examples here are tokenization, so de-identifying data, masking values, as well as potentially differential privacy, where we take noise and we add that to data so that you can no longer tease out individual data, but you can still see it on the aggregate. And really emphasizing that balance of privacy and utility. There's a healthy tension there, and it's really important that we still use the data to gain actionable insights, but we absolutely prioritize privacy. Engaging the data user community, keeping them informed, means something like regular webinars, user feedback loops, and other forums to connect directly with people using the data. It also involves transparent communication, for example, newsletters, dashboards that communicate data updates, quality improvements, or new features. And I want to mention, when we talk about data users, we mean both the data users in the community to whom we deliver data and data products, but also the users of the data at Civic. We have a strong analyst team who does work on the data prior to anybody else. And that's really as important to keep that group informed as it is those external clients. Next is collaboration, working with data submitters and providers. So here we're talking about implementing feedback mechanisms to make that connection so that someone submits data, they immediately find out any issues with that data, and we also get feedback the other direction. This is difficult for us to submit, so can you please work with us on this? We want to get that communication as quickly and as connected as possible. Next is driving sustainability via the CIVHC data products. Examples here are reports, predictive models, interactive dashboards, etc. Next is striving for accurate, credible, and timely data. Here we're talking about automated data validation, auditing processes to make sure the data is accurate and credible. And a really important point here is that it has to include civic access to real-time monitoring tools. So we really need to have that health of the data at our fingertips at all times. Next is the building and maintaining transparency. This is about processing of the data. So a data user gets the data from us, and they need to be able to understand, well, how did this flag get created? How did this get processed as it went through? How did the best and final claim determination get made? And that's the kind of information that can be important to an organization to keep proprietary, but we also need it to be transparent enough that data users have the information they need to be able to do the analysis or make the decisions that they need to make. Lastly is to provide a unified vendor experience. And this is really about the project management side of things and coordinating across teams to provide consistent and seamless service throughout the data lifecycle. I cannot emphasize this enough. We work very, very closely with our data management vendor every day in all phases of data management and reporting. And really that expertise with collaboration is going to be a key consideration. Next slide. Now a little bit about the three different domains. The first one of data collection, quality processing and enhancements. We want to regularly assess and refine the collection and quality processes based on user feedback and best practices. So we're not expecting this to be a fixed system that we put in place and everything stays the same. We know that that's not the environment we live in, and we know that there are always improvements to be made. We also want to develop automated quality checks that ensure monthly and annual data submissions meet high quality standards. So again, this is really about how well are we doing the data processing and what's the quality of the data that we've got in that database once it has been processed. And the data quality includes the decisions that we make, as well as the documentation of that data, the understanding of that data, and our ability to communicate it. The second domain is identity management. This domain could theoretically have been part of data processing, but we wanted to call this out separately because we really see it as its own discipline. And that is to create a uniform record across payers and over time to do longitudinal analysis and to do patient matching. So a lot of our work requires identification of patients in a registry or on a provider-patient panel. And we need to have an identity management system that can take that data from those two different systems and identify across them that we're talking about the same person. And again, I can't emphasize enough that the quality of that identity management is the core of so much of what we do. If we're counting how many people are in the state of Colorado in our database, that question alone requires really robust identity management. Domain number 3, the enclave data marts and data access. This is really around the environment that the Civic staff is going to use to get the data out, to use the data, and then provisioning of extracts for clients. So their ability to potentially come into that environment, work with the data directly, but not have to download or receive the data themselves. And also collaborating with Civic to produce deliverables. So again, these are the data delivery products and other reports that we provide to audiences. I want to call out the importance of secure role-based access in this environment to make sure that sensitive data is protected, but that it's completely accessible to authorized users for authorized use cases. And we want that as granular as possible. So thinking of a simple table, we want it at the table level, the object level, the column level, and the row level or the data level, so that we can administer that security and that access at precisely the level that is appropriate for the task at hand. Next slide. In terms of operational and security requirements, there are 4 I want to call out. The first is on privacy and security. Comprehensive security strategy is important. This means multi-layered security, encryption, firewalls, access controls. It means adherence to regulations like HIPAA to ensure the client confidence. Not only do we need to make sure that we're conforming to the regulations, but we also need to demonstrate that for the purpose of providing confidence to our data users and submitters that we are taking that seriously and that we put that as our highest priority. Technical support and training. This is, again, kind of the data user side of things, where you imagine someone using that data, needing to understand what are these fields? Where did they come from? How did they get from the data submission guide into this table that I'm using? And we see that in a lot of different possible mechanisms, training modules, online resources, but most importantly is a responsive support team, so that we can really get those answers to how did this happen? Is this working as intended? As quickly and as efficiently as possible. Next on this list is project management. We want practices that facilitate cross-team collaboration, not only for the ongoing efficiencies of deliveries and data processing, but also so that we can adapt to changes efficiently and across teams. Last service requirement I want to call out here is transition services. The responsibilities in the first year of the contract include collaboration and coordination with the existing data management vendor. This means we'll have an overlap for 1 year to work through the process of transition, and it needs to have a very light impact on existing work and data users, meaning we need to continue providing the products that we're providing now, doing the work that we're doing now as seamlessly as we've been doing it, at the same time standing up this new environment. So those are the key operational service requirements. That is a basic overview of the structure of the RFP itself. Yeah, that's the piece there. I'll hand it to, I think, Emma. Are you taking this one to go through the schedule?
Yep, that's me.
Thanks, Emma.
Thanks, Paul. All right, so we wanted to go through the procurement schedule here just a little bit. So you already know that we've issued the RFP on October 9th. And with that, the question period opened. And we'll talk a little bit more about questions in a little bit. But now we're at the Pre-Response Informational Webinar, or the Bidders Conference. and we're really excited that you all are here. All right, so getting into the questions a little bit. The question period will close on November 15th. And just a reminder that all questions that you have should go through the question file in the pre-bid forms that you have received and are available on the Civic Data Manager Request for Proposal webpage. So all questions should go through that. Also included in that pre-bid forms file is the file where you can submit your non-binding intent to bid. So as a reminder, the questions are due on November 15th, and then that non-binding intent to bid will be due on November 22nd. Over the next couple of weeks after that, we'll review your questions and respond to them, and those answers will be available on December 5th. Then, just over a month later, the proposals will be due, and those will be due on January 15th by 5 p.m. Mountain Time. So all of your proposals need to be in and submitted to the email address that is detailed in, again, the Civic Data Manager Request for Proposal webpage by 5 p.m. on January 15th. And then after that, we will be reviewing the proposals, and a select few bidders will be asked to participate in a bidder demonstration. Those will be held in mid-February through early March. Once those are held and we have time to review findings from those, a bidder or bidders will be chosen and selected, and the contracting will happen, and the anticipated contract start is set for July 1st, 2025. So now that we've looked at the procurement schedule, Janice, do you want to talk about response requirements?
Yes, thank you. Good afternoon, everybody. This afternoon, I'll be covering the response requirements, and all of these requirements can be found in the RFP starting on page 16. For the narrative section of the RFP, proposals must adhere to the following order and page limits as listed here in this table. Starting on page 17, you will find the requirements on this RFP specific submission format, along with the details regarding each of the sections listed in this table. Do not include any items not identified here, as they may be disregarded. Items marked with an asterisk, which include the domains and operational service requirements, references, budget, staffing, and cost proposals, all have a related tab in the Excel workbook file labeled Bidders Attachment to RFP. Items marked with the pound sign have a related attachment, and attachments are not included in the page limit counts. Next slide, please. This table lists the expected attachments to the narrative response. The detailed requirements for each of these attachments are included in the RFP. Additional instructions for attachment F, Bidder's Attachment to the RFP, are included within the Excel workbook itself. A few things I wanted to call attention to in the Bidder's Attachment Excel workbook. Included in this workbook, you will find a tab for each domain. Bidders are not required to bid on all domains, so you will complete all tabs that are applicable to the domains included in your proposal. If you are not submitting a proposal for a particular domain, please indicate that using the drop-down list below the bidder name at the top of the spreadsheet on tabs 1 through 3. All the other tabs must be completed regardless of the domain included in your proposal. Note also that in the tabs for the operational services, you will see the applicable domains listed for each requirement. If you are not bidding on that domain specified, select Not Applicable. Otherwise, select whether you can or cannot meet those requirements. Also be aware that both the staffing worksheet and the cost proposal tabs include formulas. So if rows are added, please ensure you update the formulas as needed. And lastly, I just wanted to highlight that when appropriate, Civic will issue revisions, substitutions, or clarifications as addenda to this RFP. All changes and/or modifications will be posted to the Civic website, and it will be your responsibility to check for changes and/or modifications. And now I'll pass it back to Emma to continue with the next slide.
Thanks, Janice. All right, just a quick reminder here that the response submission date is on January 15th at 5 p.m. And please remember to submit those responses through this email address. So that's datavendorrfp@civic.org. And again, that's no later than 5 p.m. Mountain Time. If you need any more information on the proposal submission or formatting requirements, all of that information is included in section 4 of the RFP. So you can go there for any more information on that. All right, Maggie, could you move to the next slide, please? Perfect. All right, and again, if you have any questions, please submit the questions to that same email. Questions must be submitted in writing using that question submission form included in the pre-bid forms. So please include them there. And please submit those no later than 5 p.m. Mountain Time on November 15th. So it's just a couple weeks away, so we look forward to your questions. And please note that all emails with questions must have questions regarding data management vendor RFP in the subject line. All right, and if you need any more information on the RFP, the links to this webinar and the slides will be included in the webpage on the Civic website. All right, looking at bidder Q&A now. So if you have any questions regarding what we covered in this webinar, please feel free to add them to the chat. Give you a few minutes. And thanks, Steph, for adding the date that you should expect this webinar to be posted. So if you have any questions or need to refer back, please feel free to look this Friday. All right, Hannah has a question here. Do we plan to release any information on the budget? We did not, I believe, include any information on the budget in the RFP. So this may be a question that we want to think about as a team. We can get back to you on that. All right, Sid asks, do you have scoring published for this RFP? How different components in a response will factor into vendor selection? Janice, do you have any response to that?
I do. There is a table within the RFP that does provide the number of points allocated to each section. I'm trying to locate the page, but it is included in the RFP.
All right. Ashley asks, the requirements in the RFP of those, what is considered new or different from what you have today? Paul, do you have any response to that?
I can give a little bit of color to that. The requirements that are different from what we have today are primarily around an openness to new technologies and additional needs for data processing and some of those pieces, but it's primarily an expansion of what we do today. Then the next question, I'd be happy to take that one too. This is where we are really, so the question is there a preferred technology provider that we have in-house that we prefer as part of the solution? The answer to that is no. We really want to choose the best technology going forward, and we are not concerned with that at this point.
Great, thank you. All right, and Janice just added that the scoring is on page 27 of the RFP. All right. Appreciate these questions, so feel free to have any more. Cool. All right, will you post details on the current solution? I don't believe we have. And Janice or Paul, do you have any insight into this?
I will pass this to Paul.
I think we would answer specific questions, but we do not have plans to provide kind of a whole view of the current solution. It's really baked into the RFP at this point. But again, we're happy to answer any specific questions.
All right, we'll give a couple more minutes just in case anyone is typing. Right. I don't think we have any more questions. So thank you all for joining. Paul, Maggie, Janice, anything else to add?
Nothing for me except to thank everybody here for coming to hear about the RFP and to ask questions. We really appreciate it, and we look forward to working with you.
All right, thanks so much. So you should see the recording of today's webinar and those slides on Friday. And yeah, please submit all of your other questions that you may have via the question form. So thanks again, and we look forward to your proposals.